co-host, so you should be able to share your screen when you get to it. Just a brief introduction. I actually met her on one of the Zooms at the Minnesota Department of Health Equity Networks, and I thought it was really interesting when she started describing her work, and she would be great for this committee. Marugi Mutiga holds a master's degree in public health and a PhD in nutrition with a minor in health equity. She works for Washington County Public Health, leading the development of its first community engagement program with a team of 4 community health workers. The work that she does started in 2001 when Washington County received an American Rescue Plan Act funding to create a community engagement program with community health workers. And that's what she's going to be talking about. So I'm going to pass it over to you. You're on mute right now, so you'll have to take yourself off mute.
Okay. All right. Can all see and hear me okay?
Yes. And thank you for joining us and being willing to present today.
Oh yeah, no, thank you for having me. I really appreciate it. Thank you for the introduction too. I've been working at Washington County. It's actually from 2022. So it's just been about 2 years or 2.5 years. I love community engagement work. I've been doing it since I came to this country about 25 years ago. I grew up in Kenya, and maybe I didn't say my name in terms of pronunciation. It's Dr. Murugi Motiga. I live in Washington County too. I've been here for 21 years or 22 years. When my son was born, we moved here. And so it's good and exciting to be able to work within my county. And also other work that I do is I also teach part-time at a community college where I teach nutrition classes because I have background in nutrition, public health nutrition, but also training community health workers. I do teach some classes there. So all this position just came full circle, being able to do the things that I love to do. And also I have a passion for really just advancing health equity. I even did a minor in health equity when I was going through my PhD program at the U of M, to help me even better understand what we are working with here in Minnesota. Okay, so I'll get into it. I'll try not to get too like a teacher because that sometimes comes through. But I'll just share some highlights, background about Washington County for those of you who may not be aware, and then how we are defining community engagement. And then I was asked to also talk a little bit about how we went about hiring community health workers, that's the CHWs. And then I'll highlight some of our community engagement work. We've been able to do a lot, so I'll just highlight some. And then talk about some of the challenges we faced and some of those accomplishments that we are proud of, and then looking ahead what our future plans are. I hope that through this you'll gain some ideas, maybe be inspired, maybe even offer some suggestions to us. We are always open because we are building this from the ground up. It hasn't been done before. And so we are building as we go and doing the best we know from from the work we've done previously in other work. Okay, so looking at Washington County, Washington County is the 5th most populous county in Minnesota. We have about 267,000 people as of 2020. I think now it's around 280,000. So it's continuing to grow. And it stretches, it's a big, it's a long county. It stretches from Forest Lake, Scandia, all the way down to Cottage Grove, and it's towards the east metro, bordering Wisconsin. And it's also growing increasingly diverse. So even these numbers have probably changed from 2020, but we do project that by 2060, Washington County will be 50% white and 50% BIPOC, Black, Indigenous, and people of color. In 2023, Washington County was ranked as 4th healthiest county in Minnesota out of 87, and that's according to the county health rankings from Robert Wood Johnson Foundation. But we also know, just like, and Washington is like a microcosm of Minnesota, how we know that there are disparities. It's the same. In Washington County, we do know that the disparities exist and were truly exposed, especially with COVID. And so what I will do, I'll just share just a small example of how some of those disparities show up. So this is just a map or a graph put together showing the different census tracts that show higher poverty rates, and that shows up where they are. So I'll just look at just census tract 1, because in our work, we want to be more impactful, looking at low income areas, because then that means maybe some of our services and our programs will be applicable to them. And so this informs our work and where to go next. So just to show that disparity I'm talking about. So Washington County is one of those more wealthier counties. Our median income is 102,000, and per capita income is 50,000, with a poverty rate or people living below poverty at 4.7 when you look at the county as a whole. But if I go to census tract in Oakdale D70912, you see with a population of 3,000, 67% being white, 15 Black, and 12 Asian. The median income there is 59,000, which is almost half or just above half, with white being at 63,000 and then Black being at 17,000, which already is a huge disparity, and then per capita income to compare to the whole county. And then persons living below poverty, there would be 6% white, and then 69% Black and 59% Asian. So when we look at that, we're like, okay, so that's an area we need to concentrate and get to connect with the people there to find out how we can connect resources to them, connect them to workforce, connect them to economic assistance, whatever we need to uplift. So the origins then of this community engagement program started, I think they had always talked about it, but then when COVID came, that exposed these disparities even more when they found out that they were really not able to reach and connect with BIPOC residents and communities. And so in the summer of 2021 is when they applied, so 2 departments, because we work across 2 departments, public health and environment and community services, where all the social services are. And so they jointly made a request to the American Rescue Act Plan funds to build this program as a community engagement, community health worker program. And with that, with the ARPA funds being approved in August of 2021, so my position as supervisor and also the 4 community health workers was approved, and then also funds to cover community engagement work and also working with trusted messengers in the community. And the goal was first to address the social determinants of health through an equity lens. So looking at food access, housing, employment, transportation, healthcare, all those different social determinants of health by listening to the community, and then promoting access to these county services, finding out what the issues are, where there's policies and systems and environment we need to change, modify so that they are more accessible and equitable to people. And then also increase effective channels of communication and collaboration. So co-creating community-driven programs or solutions through enhanced shared leadership. And what we have found, I mean, no matter how good the services and programs you have, whatever institution, if your channels of communication do not reach the people, then they are not as effective. So it's learning what's the best way for communities receive information. So our focus, so as a community engagement team, we focus on these priority populations, residents of or populations experiencing disparities, Black, Indigenous, and people of color, people who speak other languages, low-income residents, residents utilizing county assistance programs, and the elderly too. So these are the two departments, and they offer different services to residents. So we have public health and environment, and within that we have different things, immunizations, refugee health, family home visits. And then on the social services side, we also have like economic support, medical insurance, crisis response, support for families, to protect them from getting into even child protection, workforce development. So we have different programs within those or services. So those are the two departments that the community engagement team works across. So then defining community engagement became important when I first started, because I started 6 months before we brought on the community health workers. And what I realized as I was talking to my coworkers and people who do connections with the community, they either don't connect directly with community, or they sometimes will work with agencies who then connect with communities. But I brought this up because sometimes people go and give out flyers or table, and you feel like you've made and you call that community engagement. And that's not really what we are talking about as our team. We are more moving towards more collaboration and shared leadership with the community. Outreach really is just a beginning. And it's not necessarily beneficial to the community. The more we stay towards outreach consult, the more we marginalize people when their voice is not involved, even in the development of the material and how it's distributed, what should go on that material. It really should come from the community. So wherever you are in this, we encourage you to move more towards collaboration, where we are working directly with the community in partnership, where they bring their ideas, you bring your ideas, and you co-create something. And the goal is really to move to even towards community ownership of their work, because they are the ones experiencing the disparities. So that's what we are working towards. That's where we find ourselves, but we know we also have to bring our colleagues along this continuum. So I thought I would mention that, just because sometimes people do say it's okay to be whichever place you are, it's okay. From a community standpoint, it's not okay to just be at outreach and consult, because then there's a voice you're leaving out and further marginalizing people. So then the first step was hiring then the community health workers. And so we went through, and let me talk a little, and you probably already know about community health workers, but I'll just say for those who may not know, is that they are trusted community members with close understanding of the community. And they help to bridge the gap between the individuals or communities with social services that are provided. And they actively build individual and community capacity. So they will handhold or work with people to show them the process, and the communities also, so that they can grow and really have the capacity to manage or run their community the way they want. They also facilitate access to quality and cultural, and they have, of course, that cultural competency of service delivery. And the other part that's important is reporting back to the county or to the institutions to whatever institutions you're working in, to improve their policies and systems and practices so that now it's more accessible. So they'll have names like connectors, educators, navigators, all kinds of different names, but those are some of the titles and roles that they play. And these are just some pictures that I'll be putting as we go along, so you can see some of the pictures of some of the work we've done in the community with our community health workers. Oops. So what I did at first is I chose to, I started, that's around March of 2022, decided to start with connecting with Washington County communities, those priority communities that I talked about, before getting into the job description. And the reason I wanted that is to get a feel more, even though I've lived in Washington County, I really hadn't connected to all the different BIPOC communities. And I wanted to hear more from them. And I also wanted to, even the low income communities and all that. So that helped me a lot get a pulse. And then with that, I came with, and we started working closely with HR, reviewing existing job descriptions, looking at also other counties and the community health worker positions. And then we decided to look at it a bit more, and generally for community health workers, the minimum qualification is high school, and then we added years of experience. But one of the changes we made is to make sure that we included paid, unpaid, volunteer work that's related to helping people, because we also recognize that there are people, especially from BIPOC communities, who are the point people for for their community, who are doing a lot of work, unpaid work, volunteer work, just to serve their communities, and they become the point person. And I too have been that for especially the Kenyan community, connecting people to different resources, and that has just been unpaid work. It's just work that you want to do, and you don't want to miss that by including there that people should have paid work experience, offered both. And then we also offer different levels. So the CHW certification with 2 years of experience, or 2 years of any post-secondary education and 2 years experience. So that allowed people from all over, and so yeah, to be able to apply, but also included there that we were looking for bicultural or bilingual candidates who had close ties with cultural communities. And we listed the communities. We just encouraged them to apply. It wasn't a must that you had to, as long as you have close ties. We were interviewing everybody. And then there are some questions we also modified, because I'd look at them and I'd like, okay, is this, will it resonate with some of the people who I have talked with in the community too, or through my vast experience. So some of the questions were like, sometimes you'd see a question that asks in some of the ones that I reviewed, that would say, do you have experience using a translator or interpreter? And then I thought, no, sometimes I may not have used a translator, but I may be a translator and I get left out. So on some of these additional questions that involve some points, just the way kind of the county does, I may lose those points that would put me higher on the list by saying no, because they were asking using a translator, but I'm actually a translator. Or participating in, sometimes they would say, have you taken a training in racial equity, diversity, inclusion? I may not have taken that training, but I have participated in activities in my community that are advancing racial equity. So changing the wording so that it applies to everyone. And then again, like I said, experience with paid and paid volunteer, and really bringing in that lived experience and honoring that as important. So then we created flyers for the job, the community health worker job, and translated it to Spanish and Hmong and Hmong and Somali. and distributed to different communities, community leaders, cultural media, organizations, like all the different places we've connected with. Even as HR had posted online, we also recognized that not everybody goes to the website. So we want to reach people where they are and give this and put word out there that we do have a position open. And so this helped us get a good diverse pool of candidates. And I made sure we decided to interview each and every one to honor each. I think we were 30, I want to say maybe 37 candidates or something. So we interviewed each and every one. It took a lot of time, but and we got a wide variety of people, from high school to people with even masters. What I recognized through this process, that it doesn't matter what level of education, it just really brings people who have a heart for the work and really want to be there for the community and do what they can. So this is the team we created. This is the community health workers. We have Alex, Muna, Sikweya, and Kamiko. And then I'm the supervisor, and then we have 2 managers. So I report to 2 managers because we have the 2 departments, community services and public health. And so our work began in 2022. Fun fact about our team is that we speak 6 languages, and I've listed them there: English, Hmong, Kikuyu, Spanish, Swahili, and Somali. And our heritage spans 4 continents: Africa, Asia, North America, and South America. And I think we're the most diverse team in our county. Okay, so initially we started with making connections, listening sessions with the communities. So going to faith-based organizations, we have the Eastern Twin Cities Islamic Center, we have the Woodbury Fellowship Church, we have the Center, like we have different faith-based, we have residential communities, townhome communities, low-income communities, new immigrant. In Woodbury, Oakdale, Landfall, and Cimarron. Those are the cities that we've worked really closely. Again, looking at the map that we looked at before, we wanted to start there. We've worked with different agencies like Family Means and different food shelves, the U of M. The school districts have been a great partner. And we have the different school districts working with the cultural liaisons for those who have, and social workers, but also, excuse me, but also the adult and basic education. And then the cities, we work closely with them, and then also within within the county, public health also had a project they were already working on. And so we joined in and partnered with them on that. To do the community engagement part. And then also the community events, and I'll be sharing some of those that we've done. So, and also taking referrals through, we developed a community health worker card that's translated in different languages, and each of the community health workers have their number for the language that they are translated to. And the reason we chose Spanish, Somali, and Hmong is because they tend to come up as the top languages that are most needed in the county. And we also have a community engagement website where people send in referrals to. Okay, so the themes that emerged from this, so from the listening sessions, from interacting with people, came on the issue of health. So mental health across the board, all the different, whether it was the Latinx community, the East African community, even in general, the African community, among all these different communities, mental health keeps coming up as a big need. Immunizations, affordable medical, dental, and eye checkups. In some of the cities like Landfall, we saw that they had undocumented people and maybe with 10 times uninsured compared to other places. Hopefully that will end that will get better with the next year being more opened up now for insurance. But they also wanted more activities for adults and children, like Zumba is something that they've said they want. and also culturally responsive foods. For children and families, youth activities kept coming up. They want something educational or something for summer activities, homework help. Sports like tennis, soccer, swimming keep coming up as something they really want to be engaged in. And then also advocacy for children with disabilities came up. And then we also found a fathers group that meets there every week at the landfall, and they really want to co-create fatherhood programs with us. And I think it was a good opportunity because a lot of our programs, I think, tend to be more centric on moms, but including fathers, I think there's an opportunity there. And then school supplies also come up. In terms of resources, they were like, yeah, we need English classes. Some of us have been here a long time, but we just can't access English classes. It's either online or we have to take transportation and we're not able to get there. Workforce, we're looking for jobs. We want to run businesses. Where do we begin? We want to buy, some people have reached the point where they feel they can buy their first home, but then they need the Sharia, halal compliant loans. And then also needing more multilingual services in that area, because sometimes people get cheated because they don't understand some of the language that's spoken. And then also community leaders, there was also that thing that came out. They want to build community capacity to handle their own problems. And so providing leadership training and supporting youth, and that we were able to do, provide leadership training. We've been able to do in some, and infrastructure gaps, the meeting spaces. It's just amazing how much there is not enough meeting spaces. And so that became something that we look at more. And we've also opened up, because the libraries, Washington County, do have meeting spaces, but people did not know that you can meet there for free. So again, it's that communication. And also technology challenges. Some places don't have good internet access, or so it makes it harder for them to access. So we have to find other ways. So we responded then by starting to deepen our connections. We brought vaccines to the community, started distributing COVID tests to the community. And that was a good opportunity for me to meet the community and to learn more about what's going on, the size of families, and all that. We were able to get a grant through, again, the HOPE project going on at the County with Public Health, Healthy Communities team. They were able to use some of their SHIP grants and provide us Zumba class and soccer, and kids were so excited. The only thing is that we are not yet been able to reach the point where we are able to sustain this. So we were only able to do a couple classes, but it really needs, because the community really wants this, but we need the funds to be able to sustain. Cooking classes from the U of M, Cooking Matters program. They came and did some classes in Cimarron and City of Landfall. Cimarron is in Lake Elmo. And the kids with the teen class, and the kids loved it, especially because we were able to take also groceries home and try recipes at home. So that was fun. English classes, one of the CHWs approached the community education and about these English classes, because people are saying they want the classes, but they're just not able to go to Stillwater or to Oakdale to do that. But there are community centers near where they live or within their community where they can walk to, and if they're held in the evenings. So he was able to advocate for them, and Stillwater's community ed was really willing to help, and they decided, yes, we can try it out. And they did, and people showed up, and they showed up every week. They were showing up, and so that continued on. The turnout was really good, and it's not something they were, which surprised them, but sometimes that's why it's good to listen to the community and what works for them. And then providing resources, meeting people where they are is important. And so We've been hosting events and also tabling in the community just to promote some of these resources and services. And the communities are like, you mean these things are there? You mean you've seen us? You mean there are people like you there at the county? All we see is a wall. We don't know that there are people in there. These are people, we're talking of those who have not been served before. And so this has really opened up. And so we've been able to do these back to school events like at Oakdale and Landfall. And these have brought the largest numbers the county has ever seen, because this is new for the county. These are just ideas brought on by the community health workers. And we average anywhere from 250 to even 500 people coming for this. And then also we have the community mental health and wellness event that we do, especially with the East African community. And that also brings more people because we are really trying to address the mental health and well-being and mental health stigma that sometimes is in our communities. I thought I would include these pictures. I know there are many, but I just wanted to show you like the last back to school event that we had at Oakdale, put together by two of our community health workers. Was a really fun one, and really brought a lot of people. So we made sure we had, obviously we bring all the resources from the county, as many as we can, and we put up tents and people are able to walk through. But we also bring their incentives that will get people coming there. So we have like the barber who's there to cut hair because it's back to school, and that's usually something that people need. We had the DJ this time, so it made it more lively. We have the school supplies to the right there, and people started lining up very early because this is one of the things they've said that they really want. And so even before the event started, people had already lined up. We bring the face painter, and then we also bring our vaccination trailer. And we had a lot of people get their vaccinations done that day. And something else we also did this year, and that's what the people are doing at the bottom right. We had a survey just to hear from people what are some of the resources that they need. So we use that opportunity to also hear from people. So it can serve so many different things within that event. And the event is usually about 2 to 3 hours. So the other thing we're doing is increasing community capacity. So trying to invest in building their capacity and training community leaders. So at the Landfall, City of Landfall is small, about maybe 800 to 1,000 people. 50%, about 50% of them are Latinx. And so from doing the different, and this again, this is one of the projects we joined the Healthy Communities team of public health on their HOPE project. I think it's healthy opportunities for people everywhere. I want to say that's what it stands for, but anyway, so we joined that. And so through the different communities we held, and would hold it at this park outside at the Sunset Park. Again, but like I said, there's no meeting spaces, so we meet outside, and we always pray it doesn't rain, and it doesn't. So that works. And then a group of residents started forming and getting to know one another. So these events created that opportunity, and they started meeting now on a monthly basis, and then asked for leadership training. And there were a couple of them went for the training that was done in Spanish somewhere in St. Paul, and at the neighborhood house, I believe. And then they've been going through mental health training because, again, that came up as a big need so that they can recognize it in themselves and also in their children who are going through also a lot with the bullying and everything that's going on in the schools. And then also connecting them to the city council, where they can also take some of the issues that's going on in the community so that they can. And so some of the times the community health workers would go in there even as translators, so that, and then slowly even the city council started coming to the events and being part of that. And so it has created that bridge, which is what we want. And eventually we would want that leadership group to continue to lead the event. I mean, whatever is going on in the community. We also meet with the East African community, again, around mental health and well-being. A group of moms formed from one of our meetings and events, and it continues to grow and address some of those issues, especially because they were impacted by a death that occurred in the community as a result of a parent having a mental breakdown, which was unfortunate. And so we wanted to be there and provide all the resources, and also advocating for cultural liaisons, because people have issues with that's going on in the school. Some have kids with disability, not knowing how to advocate, and cultural liaisons do so. We really talked with the community and the school to get the cultural liaisons, and the board approved that, and they started last year, which was great. So other things that we do is connecting residents to local government. We really would like to connect with the cities and also with especially public safety, because we know some of the communities our clients or people come from do not have a very positive relationship with the public safety. But that is something we have been promoting, because just as one of those priorities that we feel is important, that we start to bridge that gap. And so we've worked with the city of Cottage Grove, we've worked with the city of Oakdale and city of Woodbury, especially Woodbury and Oakdale. And like here is Oakdale, and you can see the police officer talking with the parent. And that interaction is what we really want to see. I live in Woodbury, and we've been able to work with the police, public safety on that, so that when issues come up, we already know who to go to, how to address it. And they even have a multicultural advisory council. And then there are also different programs that the cities have that people don't do. Like they have home buyers incentive, they have small business resources, down payment assistance. Like there are so many things that we just don't know exist, and we've been able to connect. Food insecurity is another, so we promote farmers market bags. That was a program that was there last summer, where people are able to triple their dollars. And so one of the CHWs was able to introduce, because people didn't know about farmers market. We have one in Woodbury that participates, not all participate, but there is one in Woodbury, and we have people in Woodbury that would qualify, that are on getting the SNAP benefits, the Supplemental Nutrition Assistance Program, that could benefit from this. And so one of the CHWs was able to work with them, with the community, and bring them out, which was great. And then Ramadan and halal food distribution, again around Ramadan, getting the culturally relevant foods, working with a local food shelf for basic needs. And so through that, they've been able to serve over 100 families, whether it's halal meats, the dry foods, and cultural foods that they recognize, and also in amounts that that are good. Because there's some food shelves we've worked with where they tell you can only fill up this small little bag. But what the community members told us is that small bag is not going to feed anyone. I'd rather starve. I can't go home. I have a family of 8 or I have a family of 10. That small bag is not going to help. So we've liked working with some of those. The other area that with food insecurity has been partnering with community leaders to advocate for spaces for community gardens. And so we worked with one of the churches in Woodbury, and they provide decent space that people are able to grow their own traditional vegetables. And also with the city of Cottage Grove, the Parks Commission approved, and we were able to get 40 plots this year. That's what you can see down there. And the fun thing, I like that picture because kids got involved. They were learning how to grow food and watching it grow through the season. And then we had a nice potluck at the end. It was really nice. It has brought communities together. It was a diverse group. So people are learning from each other, from different, heritage, ethnicities. And it's been really like a good thing. It's a way to heal. We believe these things do heal our bodies, they heal our land, but they also heal our communities. Then we've done naloxone training, as we've seen with the opioid overdose prevention training. And then this again, we did in one of the communities in Oakdale with one of our CHWs, connecting with the people in public health that do this training. So he came out and did that, and everybody got a certificate and a naloxone kit. It was very popular, and they said they would like to see this information passed on to other residential areas. So this is one of the apartment buildings, not apartment, townhome communities. And so there are others that were willing to do this. We also do fun things. We also promote fun things. Joy is important. So again, hearing from the BIPOC community, wanting to access the parks, but unfortunately, the Washington County parks, you have to pay $7 a vehicle permit to enter, and or every time you enter, or 30 or 35 per, I think it's $30 per year. And so that ends up being a lot for people to pay. And so, but they do want to use our parks. And so we've been feeling like the parks should really be free, and that's what we are advocating for. But as we work through that, we're able to, we've done activities where we bring the community, get transportation, buses to bring people into the park and enjoy maybe a hike. We've also advocated, and public health was able to find funds that gave free entry park permits. And so we are able to distribute that to people. And that has actually been quite a positive thing. People are going to the parks more, and that builds a case for working again with the county leadership to explore ways we can make these parks free. There are other counties that have been able to do that. Other fun things that the parks are doing is also, they're also working on equity and bringing, so snowshoeing. I don't know how many of you do know snowshoeing. It's not something, excuse me, I grew up doing in Kenya, and winter is not quite my thing. But they brought this, and a number of East African families went, and they really enjoyed it. And then also kayaking. I tried it. At least I tried. I got on the kayak, 5 minutes and I was out. But people really enjoyed it and wanted more. I remember there was even this kid that went, and immediately, like, she was just happy and kept rowing, and she's one of the people over there. She would go with it. And I was like, wow, that's amazing. And that's what we want people to experience. So, so coming back again to the community health workers, in terms of the work that they are doing, so their work spans individual engagement, as you've seen from these events that we put out, and they pick people from there. People will come and say, oh, I've had this issue, or I've had this problem, or I applied for this, or I really am I'm about to lose my home, I don't have rent. So they pick, they're able to pick clients from there too, and follow up. So there's that individual, but there's also that community engagement that they continue. So each of the 4 community health workers have the different places that they go, land, so our Spanish speaking community health worker, Alex, will mainly be like in Landfall and Cimarron, but he's also in other places, but mainly there. And then Woodbury and Cottage Grove, we do have a large East African community there. So we see Muna there. And then Oakdale, it's pretty diverse. We have a large African-American Hmong, but really other too. So Sikwe and Kamiko are over there. And I believe they're on this call too. So some of the top reasons we've seen that people are reaching out to a community health worker, as you can see, health insurance is very high. People really need help with filling out the forms, can be quite complicated, and walking them through that. So health insurance becomes big. Financial status, economic assistance, applying for these different SNAP and cash assistance and all that. Housing is also Another one, energy assistance, rental assistance, like I'm facing eviction. Nutrition is, comes up, employment. So these are the different reasons that people are reaching out to community health workers. So they're busy. And I'm trying to move a bit fast. I hope I'm not moving too fast, but in terms of challenges, so aligning our communication methods between now the county and the community. So for example, when I first started, I was like, hey, can we use WhatsApp? I need to create a group. This is how we communicate. But then the county was like, what's WhatsApp? Okay, it took a bit of time because they also want to ensure security of data and all that. But mainly WhatsApp, we're just using to pass on information. We are not managing any clients there or sharing any personal data. And this is how we were able to do even during COVID with other counties, creating these large WhatsApp groups when there is time for vaccinations or any information or testing, then we could you can send out 200, 300, even more people. And so finally we did get that. But we're still exploring because, like, for example, with the Hmong community, we found that we do need to have like a Facebook group, but that's, again, something that we are working through. And then websites and things, or going to look for information that way, is not always the way that people go. So even though there's a lot of information there from the county, so it's bridging that gap, and so that's an area that has been a challenge, but the county is working through that. And then also getting data to inform our work. Remember, like the information I showed you of, like, let's say that census tract, that we know there's a large number of people living below poverty line. But how well are we serving them? What's the data from DHS showing us in that area? Have we been able to reach? How many people have applied for these different programs that we have? So that data we've not been able to get that data, but we're still waiting on that. And then changing systems and practices takes time. So sometimes it can really take a lot of energy, and like, how are they not seeing what I'm seeing? Because we see things from a community perspective, but then there are also all these policies and practices and things that the county does, or even you will see in your institutions, that sometimes don't align with the value. Like, for example, sometimes when we first started, we're like, yeah, we need to have food, at these events. They're like, food? We can do snacks. I said, no, you can't bring community. It's a cultural thing. We need to have food. But we do recognize the policies in place had not opened for that, because, again, it's not the kind of culture or something that they follow. And there are good reasons for how they control that. But now trying to change that so we can say, actually, it is okay. And they've been able to do that. So depending on where the funding is coming from, some does allow for that, which is great. So that has allowed us to be able to do. And then limited capacity to address all the issues. We are only 4 of us, or 5 with me. And there is so much. We are yet to reach Forest Lakes, Candia, like we haven't even gotten up there. So there is so much to do. And the funding was only for that. And then funding is also coming to an end at the end of this year for ARPA. That was, quite generous. Now we have other funding to continue, because this program is not going anywhere. It will continue, because this is not the sort of work you start and stop. That can cause more damage. So the assurance is there to continue this work and finding other funding. And then on a community standpoint, the complicated county application processes for social services is a concern. Where do we get access to free medical and dental care? Even lack of adequate funding for these youth and adult activities. City of Landfall has asked for Zumba classes for so long. We've reached a point now we are not sure where to get that. So if you have ideas of where we can get money that we can support, that would be great. Limited mental health resources, that's community-based, that's culturally responsive. People want to handle you know, when you come from a culture of collectively handling problems, you want to also find that space where you can talk about mental health collectively. We're able to do that in the city of Landfall with the with the training that they were going through, which was great, but it's not the same in all. And then sometimes finding support or funding to do that, because a lot of the mental health resources available are one-on-one, maybe therapy sessions, and sometimes also finding someone who identifies with your culture can be difficult. And then just showing value for community consultative work. We know we are working with community. They are giving us a lot of great information. How are we compensating them? We can't really give gift cards. That's again one of those policies, or, but we are able to do food now. Childcare, not really. So some of those things come in the way as challenges, and I'm sure you probably identify with that. And then I just added this to show some of the challenges faced now when you're working with individual clients. That's the other part, is more in the community level, but working with individual. So language barriers comes up, just awareness of these county resources. The immigration status comes up as a concern. Technology, they may not have access, or just even lack of support system when emergency situations come up. Sometimes our populations are new to the country, or separated from their loved ones. We've had people come up from the border, separated from children from their parents and all that. So a lot of trauma going on too in our community. Transportation is always a thing. So in all that, and as I conclude, I would say we are proud of our accomplishments in the last 2 years. We've hired a diverse, great team of community health workers. We've developed and are developing this process of community engagement. We are breaking silos in the county, because people sometimes tend to work on similar things but separately. So we are collaborating between departments more and more. And our team is able to, because we work across, and so we are able to see, oh, what's going on in public health? Oh, we could combine with community services. If there's mental health going on this side and this side, we bring them together. And advocating for accessible and equitable countywide communication. We just keep saying multiple modes of communication are needed. We can't just use one. We need to find different ways of communicating. Making these recommendations to the leadership has been a good accomplishment, where we've talked with the directors and proposed ways that we could change, whether it's hiring diverse staff, again with communication, taking time, looking at how we serve our clients equitably, spending more time with people who maybe English is not their first language, or who haven't gone through this sort of system. And then connecting people to resources has brought them really closer, and bringing those resources closer to the community has really helped us build even more trust. There's some surveys that has been done, like at Landfall, and they say, oh, we completely 100% trust, Alex, Maria, the people working over there. Our leadership is also connecting more with diverse communities. So when we host these large events, we invite our leadership, including the commissioners, the elected officials too. So they come and they also are able to meet and see the work, because they're the decision makers. And what we recognized early is that the people making decisions are not connected to the people or to the places they are making decisions about. And that's where the divide, sometimes the challenges are. So the more they can come and see the people, and the people see them too, and are able to talk, and we will point out to them and say, hey, that's your commissioner, go talk with them. This is your public health director, or this is your community services director, talk to them. And hearing those stories directly, we believe is helping also advance our work. So we'll continue to expand our work and deepen our engagement as we identify leaders from diverse communities. And one of the ways we are doing that is that we've contracted trusted messengers, some of whom live in Washington County, and they are identifying and making connections with diverse communities. So we are able to continue. Some have large WhatsApp groups, some have, Facebook pages where they connect, they're able to now even spread the word further and collect this information from members of the community on how they best want to receive information, and also helping us kind of develop some consistent messaging that we can. And then sometimes we want listening sessions, sometimes we want focus groups. They're able to help us even bring those, so we collaborate well that way. And they definitely keep us informed, and we also keep them informed on what's going on. So looking ahead, in terms of future plans, in terms of that changing policies, right now, we, again, like I said, communication is a big thing. So right now, the county, both the community services and public are developing a framework that will better support communication. And once this framework is developed, it will go across all the teams in those. And I have a feeling the county, at the county level, they'll be looking at what we have done. So it's good that this is being developed. There's also developing a compensation policy for community members. We do not want to continue to extract from communities that we are learning so much from. We are able to pay consultants, but this is like a community level consulting kind of, because we are getting a lot of information that's making us look good, but we don't want to take that at the cost of not compensating them. So having a compensation policy will help. And then Washington culture and engagement with community is changing. People now understanding what engagement is, and even approaching us, our team, to give them input, or being consulting with us on different things, and coming out with us, and we help them create those opportunities. And then in the strategic plan, we can see some of our recommendations are in there. And one of the ones I saw was that they are exploring ways to free the parks, I think by 2026. And I was like, ooh, there's something there. So our voice is being heard, leadership is listening, but they're also at a point where they know, as they look at the numbers, that they do need to do things differently, and they are committed to it. So we are very thankful to them. And so as I conclude, I'll end with this African proverb that if you want to go fast, go alone. But if you want to go far, we go together. And the people we've been going together with, again, our amazing community health workers, and the team, the whole team, the community engagement team, the county leadership, we're thankful to them. We push them on some things. Our trusted messengers who are now helping us even promote our work further. Our school districts have really been very helpful with us. And then also community partners and leaders, we are really grateful to them. And so with that, that's my information, their contact information. And also our community health workers, we have an email there, and also our website, Ask CHW is our email if you need to reach out to us. And I thank you for the time. I hope I didn't take too long, but I'm willing to take any questions or comments. And I thank you for this opportunity.
Thank you, Dr. Matiga, for presenting to us. I think it was very interesting.